Morning. I have a glare on my window. Hold on. How are you ladies doing?
Hello, hello.
Lynn, you're on mute, Missy.
Okay, how about that?
There she is. So I couldn't figure out how to export like a good list of who and all was coming. So I think we should just roll with it. We've noticed like a huge decline in Zooms. I almost wonder if people are just kind of over Zoom.
I can relate to that for sure.
We're getting some logins here. Happy Friday. Anybody have fun plans for the weekend?
You know, I'm Christmas decorating. I'm just bypassing Thanksgiving.
Yeah, we're similar. We have so much to do between now and the end of the year. It's a lot. And so I was just realizing how close the end of the year is.
Here, knock up.
Seeing some familiar faces now. I see. Hi, Lauren. Lauren Colpson. Hi, Kim.
Good morning.
Good morning.
How does Lauren stay so still?
Yeah. Oh, man. It's a beautiful day outside. So you all, we can make, who should we make a co-host if you all want to share a presentation or any type of resources, or were you wanting just to speak more to it?
I'll probably speak more to it, Shannon.
Great.
That's okay.
No problem. Then we'll monitor the waiting room and all that fun stuff.
Okay, sounds good.
We'll probably give, it's just now 11, so we'll probably wait maybe a few minutes before we get started. Appreciate you all joining us.
Thanks for having us.
All right, well, I'll go ahead, like to take a minute to introduce you all. Hi, Amanda. And then we'll go ahead and jump in and go from there. So I think I know everybody on this call, but my name is Shannon Badger, and I am one of the partners at Badger CPA firm. And the intent of this is to just provide content that's valuable for business owners that might help them be more successful and just give them sort of information they need so their business can thrive. And one of the biggest challenges in probably the last 5 years or so has been increased healthcare costs and having a healthcare strategy for your business that is cost effective, but also provides value to your employees and takes great care of your team members. And so I asked a business financial group to join and sort of help give an overview of the current healthcare landscape and trends that are coming and things like that. And with that, I would like to introduce my dear friend, Lynn Weirich, who is a shareholder of Business Financial Group and also a founding partner of the firm, and give her a chance to share a little bit about Business Financial Group, what they do, and then we'll dive into healthcare.
Well, thanks, Shannon. We appreciate the opportunity to be here. BFG is an HR consulting firm, and we offer a variety of different services in a menu-driven platform. So we help clients in areas related to HR, payroll processing, establishing and monitoring and managing employee benefit plans and retirement programs. And I have with me today my colleague, Amanda Larson, who is a longtime consultant in our employee benefits area. She's also ACA certified and has all the initials after her name to prove that she's a true benefits. She refers to herself as a benefits nerd. We call her a benefits expert. So we're glad she's here too. So I think what we wanted to start with is really talking about the fact that healthcare continues to be a challenge, and for employers, but also for individuals to afford and manage. And we really don't foresee that changing anytime soon. As we know, most insurance coverage is actually delivered through employer-sponsored plans. In fact, recent stats show that 89% of the private insurance that is in place is actually delivered through the workplace, through the employer. So it's been around a long time, since World War II, when the labor unions really began to push for that. And since that time, it's become really an essential benefit for our employees. And as you try to recruit and retain associates, we've also seen surveys that show that employees look at their healthcare insurance second only to salary in deciding whether or not to join an employer. So obviously it's very key. And now that the election is over, sort of, we also wanted to talk about the proposals that are out there and even look at what some of the plans are on the agenda and things that you'll need to think about and navigate in that continually changing landscape.
Thank you very much. And I guess just to start it off, can you sort of give a high-level overview of various options that are currently out there and kind of what you all are seeing in the small business space?
We can definitely do that. I want to start just very quickly with the recent news on the Affordable Care Act, because what we're going to address is, what is and what we can anticipate, and then what exists today in order to navigate through the Affordable Care Act. And so you've heard the news this week. The U.S. Supreme Court heard oral arguments about the California versus Texas case, which challenges the constitutionality of the Affordable Care Act. And the questions really that the court have to answer is, number one, is the individual mandate unconstitutional? And then if it is, what else from the law falls and what can be kept in place? And if the entire act is determined invalid, then the court has to consider whether the entire law is unenforceable, or whether it should be unenforceable only to the extent that provisions injure the individual plaintiffs, is how it's written. So you'll recall in 2017 that Congress removed the individual mandate penalty. So the question is, while that's been struck down, can it be considered severable from the bill? And the reality is we won't have a decision till sometime in Q1 or Q2, possibly. But interestingly, during the teleconference arguments, two key members of the court, two very conservative members of the court, considered conservatives, Chief Justice Roberts and Justice Kavanaugh, both said plainly that Congress's decision in 2017 to zero out that penalty for not buying health insurance did not indicate a desire to kill the entire law. And you may also remember that Roberts wrote the 2012 Supreme Court decision upholding the act's constitutionality. And so a quote from him this week is, "I think it's hard for you to argue that Congress intended the entire act to fall when the same Congress that lowered the penalty to zero did not even try to repeal the rest of the act." So, I mean, all that said, we still have to wait for the decision, but the chance of the court reversing that 2012 decision is probably unlikely. And Affordable Care Act is pretty far reaching. It impacts everyone, individuals, small companies, large companies in a variety of different ways. So Amanda's going to just at a high level talk about what is today, what is in the Affordable Care Act that impacts all of us as employers, and how to navigate that. So Amanda, if you will.
Sure. So the options that we have in the employer market really depend on your company size, and that's based on the number of employees that you had on payroll on average in the prior calendar year. If that number is 50 or fewer, then you're a small employer and you're subject to the small employer requirements. If that number is 51 or more, then you're a large employer and you have some different options. Looking specifically at small employer options, you've got your traditional fully insured plans. Under the Affordable Care Act, these are required to be community rated. So the rates under the plan are based just on the geographic location of the employer and the ages of your enrolled members. Technically, they can also look at tobacco status when they're factoring those rates, but most insurance companies do not. And so they don't take into account the underlying health status of your employees or your expected claims. Prior to the Affordable Care Act, they were able to look at that to some extent. And so generally you would see younger, healthier employers or employer groups have lower costs, and those that have a little bit higher average age or more higher expected claims would have higher premiums. The intent with this was to bring both of those kind of more in the middle and average it or spread it out among those younger, healthier groups and a little bit older or more health expensive groups. The reality, though, was that you didn't have enough of those younger, healthier groups that stayed in the pool or joined the pool to begin with. And you did have some of those groups that couldn't afford it in the past because of their older average age or health expenses that were able to participate in those markets now because it was averaged out. But without the young, healthy people in the pool and with more older and more expensive health conditions in the pool, what we saw there was rapidly increasing premiums. And so today, the average cost in that small employer, community rated type of plan is pretty high, much higher than it was when we first started out. Another thing to note is that when you are fully insured, your plan designs have to meet certain gold, silver, platinum, or bronze type levels. This is designed to pay a set percentage of claims for a standard population. But as the underlying cost of care for those claims and that standard population changes from year to year, this is really a moving target. And so what you'll find is each year, instead of being able to continue the same plans that you had before, you are moved into a new plan each year with those deductibles and copays and things inching higher and higher. An alternative that's out there on the small employer market is self-funded plans or level-funded plans. So this is a form of self-insurance that's really designed and tailored for smaller employers. So you pay monthly premiums just like you would on a fully insured plan, but they go into different buckets. So one bucket goes into pay actual claims costs. So when your first claims come in, it comes out of that bucket first before it touches the insurance company dollars. Another part of your premiums go to pay stop loss insurance, and that's the insurance that kicks in to pay whenever your claims fund is empty. And then you also pay administrative costs for the insurance company to process claims and for them to use their provider network and that kind of thing. And so in this type of arrangement, you're able to base the rates on the actual expected claims of the group. And so your younger, healthier groups typically see much lower premiums in this scenario. Now, most of these level funded plans are available for employers with at least 5 enrolling employees. There are some limited situations where even smaller employers could potentially look at a self-funded or level funded type plan. And then when we look at large employers, those that have 51 or more total number of employees on their prior calendar year, they have a lot more flexibility in plan design. Again, they can have both fully insured or self-insured plans, but in both of these instances, they're going to be underwritten based on their expected medical expenses. So you're not going to see the big difference in premium between self-funded and fully insured like you would in the small employer market. And most of the time, large employers will stay on a fully insured platform until they have several hundred employees enrolled so they can have more predictable expected claims, where their potential for savings and self-funding comes from is by relying less and less on the insurance company to kick in claims and more on them paying their own employees' claims costs. So when you have a very large pool of employees and you can accurately predict their claims, you can cover more of that cost and just pay a small portion for the insurance for that additional cost. But most of what we're seeing in the large employer market is just dealing with affordability of coverage and avoiding the fines under the Affordable Care Act. So those fines really apply if you have 50 or more full-time equivalent employees. I want to mention that that's not the same definition as just large employer for the market. That looks at your total number of employees, whereas the fines only apply if you have 50 or more full-time equivalent. So your part-time person could count as a partial full-time equivalent, where they count as one employee in the other definition. So you could be a large employer in one and not the other. But those fines that I mentioned, there's one level of fine if you don't offer coverage at all. And that coverage started out at $2,000 in 2014, and it inches up. It's currently about $2,500 per employee, per full-time employee, and less your first 30 employees. And so if you don't offer coverage at all, that's your penalty. Now, if you do offer coverage, but that coverage is not affordable for your employees, or it doesn't meet a certain minimum value, so again, paying a set percentage of claims at least for a standard population, then you're subject to a penalty for each employee, each full-time employee that is able to go out and get subsidized coverage through healthcare.gov or through the public exchange. I can't talk today. That penalty was about $3,000 when it started, but it's inched up closer to about $4,000 now. And it is only triggered if you actually have a full-time employee that actually doesn't get the premium tax credit through healthcare.gov. Now, another strategy that we've seen many large employers do in recent years because of those requirements are Mec Plans, or minimum essential coverage plans. And so minimum essential coverage is the term that we talk about when we're talking about the individual mandate, where it said individuals had to have minimum essential coverage or pay a penalty. And when you're looking at individual coverage, there's certain things that define what is considered minimum essential coverage. But in the group market, it said as long as you have an employer-sponsored plan, that meets minimum essential coverage. And the minimum requirements for a group plan is it had to cover preventive care with no cost sharing and no annual or lifetime limits. So a minimum essential coverage plan was essentially a self-insured plan that just covers preventive care with no cost sharing and no annual or lifetime limits. Now, you can add on additional services. Sometimes they would add on telemedicine services or limited primary care through specific clinics, prescription discounts, that kind of thing. But these type of plans generally don't cover hospital visits, surgeries, imaging, so they don't really cover the protections for those catastrophic claims. It's really your day-to-day routine, your preventive care, and maybe a few other items. Because it met the individual's requirement for minimum essential coverage, many employees would choose this option instead of going out through healthcare.gov or something like that, because it was a lower premium cost, again, because it's just covering preventive care. So the employer would offer this in the hopes that the employees then would not go get individual coverage through healthcare.gov and trigger penalties for them. But if an employee wanted to, they could still go out and get individual coverage, and if they get a premium tax credit, it would still trigger that second penalty for the employer. And so sometimes you'll see these types of plans also offered alongside a more traditional type plan that at least meets minimum value, so that it can avoid penalties altogether, but still with the hopes that your employees will lean toward the lower cost minimum essential coverage version versus the true minimum value type plan. And just want to mention, all of these group health plans can be paired with some other arrangements that help pay direct medical costs. So you've got flexible spending accounts. You can have this type of plan regardless of what type of health plan you have, or even if you don't have a health plan. It's primarily, though, employee dollars that are contributed up to a certain limit, and that can be used to pay for their medical expenses. You've got health reimbursement arrangements. These are employer-sponsored plans where the employer funds them to reimburse employees for their health plan costs. But because it's considered a group health plan, it does have to be paired with something that at least meets that preventive care requirement with no cost sharing and no annual or lifetime limits. And then finally, health savings accounts. If you have a qualifying plan, the IRS says it's an HSA qualified plan, then you can also, as the employer as well as the employee, contribute into those health savings accounts.
Can you unpack, Amanda, a little bit what you're seeing as far as different employer contribution strategies and kind of what you're seeing in the market there?
Sure. So there's a lot of flexibility with contribution strategies, but at minimum, most insurance companies are going to require that the employer pay 50% of employee-only cost for the lowest cost plan that is offered. Although the average that we see based on the annual Kaiser Family Foundation Employer Benefit Study is employers pay about 86% of the cost of employee coverage. That can vary anywhere from the 50 to 100, but 86 is kind of the average. Now, when you're offering multiple plan options, many employers will use a defined contribution. So you set a set dollar amount, usually based on a percentage of one of those plan options. And then if the employee wants to choose a richer plan than that base level plan, they pay the difference in premium. And we also see sometimes a flex credit arrangement, which kind of takes this defined contribution and expands it beyond just healthcare coverage. So this is where an employer can set a set dollar amount that they can use for health plan coverage or for dental or vision or anything else that's pre-tax eligible. You can even use some of these dollars toward HSA contributions or FSA contributions in limited situations.
Thank you. I appreciate that. Lynn, outside of the options that Amanda just discussed, are there just other options outside of the traditional group insurance models?
Sure, you've probably heard about association health plans, particularly in the last few years, and they've actually been around for a long time under old rules. They're limited currently and have quite a few restrictions. The rating wasn't necessarily, didn't make them cost competitive in all situations. So in recent years, there was an executive order to revisit that, and we actually had some new rules proposed that would allow association health plans based on geographic association rather than industry association as the prior plans had required, and it had a lot more rating flexibility. And you may have even seen some plans in San Antonio start to roll out in 2018. In fact, some of our chambers had put together some association health plans, and people were actually beginning to benefit from those. That rolled out in 2018, and then a judge threw them out. And so DOL appealed that ruling, and final arguments actually took place last November of 2019, and we still have no news on those. And so we're not sure if they're going to be available going forward, particularly since they're not discussed in any part of Biden's plan for healthcare. So without support, it's likely that we won't see that at least anytime soon. Another option is something called a captive plan, and that really is a self-insured plan that pools different employers together and avoids some of the more onerous requirements of Affordable Care Act. There are some pros to that. There can be potential lower costs for certain employers, but just as Amanda talked about earlier, there are generally winners and losers anytime you pull risks together. And so often those can be very attractive in the first few years when they're, the claims, the group comes together and there aren't a lot of claims, but as you see risk increase, sometimes healthy groups will jump out of those, and that pool continues to, have unhealthier claims experience. So you can have some higher risk in the long term, but those can be, attractive in certain situations. Another option that you hear about are the PEO options, the professional employer organization. And generally the idea of being part of a PEO is that there could be some cost savings, again, looking at that whole idea of pooling risks together. But in the simplest terms, a PEO is an all-in option where the PEO co-employs your staff and manages your payroll, your HR, and your benefit plan. And sometimes that, depending on the structure of the PEO, sometimes that will allow you to be on a large group platform, which gives you a similar rating structure to what Amanda described in that self-funded market for small employers. So it's really just giving you access to that market, which you can get on your own. And the reality is that the individual company within each PEO, each one that signs on with that PEO, is the demographics are still considered in the rating, and more often than not, they're still underwritten. So if there are any cost savings, you can often offset those with the cost of the percentage of payroll that is charged for running those other services. So you really have to look at the whole package. You know, could be beneficial in the smallest of employers, but you want to look at, you know, what you're currently paying for those other services that are getting wrapped in that you can't really carve out. So you don't have flexibility as well, where when you're in the open market, you can work with any carrier, any plan, you can have a combination of plans, and of course you would be limited to whatever that PEO would put on the menu for you.
I'm glad you touched on PEOs, because I think that's a lot of, a big part of a lot of companies' strategies to try to move to PEO model. But one other risk area I'd like to just mention is we've seen more companies where maybe they were working with a PEO and maybe something didn't get filed correctly or something was done incorrectly. And then ultimately that employer, you're still responsible for that taxes and that reporting if something goes wrong. And so you just really want to make sure that you're vetting the company that you're working with, because it opens you up to a lot of exposure if your payroll tax and things aren't handled correctly. And we have seen that happen with clients before. So what about, Amanda, what about options in the individual market? So if you're a small employer and maybe you're not ready to implement a group insurance plan, but you want to try to help your employees in some way, what are some options that you've seen that work well?
Yes, sorry about that. First, just wanted to talk about what's available in the individual market to begin with. So in the individual insurance market, as far as Affordable Care Act compliant plans, you've got limited plan options. You've only got a few insurance companies that really offer individual coverage, Affordable Care Act compliant individual coverage anymore. I do want to mention in Bexar County, one that we have seen a lot of recently is Oscar, and they're relatively new. And we've heard a lot about them just due to some catchy advertising and user-friendly technology. And they do have some decent plans, but in general, when you're looking at plans in the individual market, there's going to be some differences versus what you would see normally in a group plan. So just some things to think of when you're looking at individual plans. You'll typically see higher out-of-pocket limits, and they tend to go in line with what the maximum allowed amount is, and that's indexed up every year, and currently is in excess of $8,000 is the maximum out-of-pocket limit per person. So families twice that. And you'll typically see, while they have decent coverage, decent copay levels for primary care, physicians, and for generic drugs, your cost sharing for a specialist and for brand name medications are going to be much higher. And you'll also generally see they have smaller provider networks. And some of them are HMO platforms where you're going to have to name a primary care provider and get referrals to see a specialist. So when we're looking at individual coverage options, just need to be aware of those issues. We're not necessarily looking apples to apples at what you would see in the group plan market. Now, if employers want to help employees with the cost of individual health plans, there are a few arrangements where they can do that on a tax favor basis. First, I want to talk about the Qualified Small Employer Health Reimbursement Arrangement, or QSERA. So this was an option specifically for small employers. So if you met the definition of an applicable large employer, this option is not available to you. But this option allowed you to have a health reimbursement arrangement where you can reimburse employees' costs for qualified individual health insurance premiums up to a certain limit. Now, you do have to verify that employees have certain qualifying coverage. So generally, that's going to be Affordable Care Act compliant plans. And there's a lot of other types of individual plans out there now that don't meet the requirements. And so you have to have, there's some notice requirements, and you also have to verify that they enroll in and maintain coverage in those qualifying plans. And so in addition to the actual reimbursement of the cost of coverage there, you also have some administrative costs for a third party that helps with your plan document and your notice requirements and helps verify that your employees do have that minimum required coverage. Now, more recently, we've had that idea expanded into the Individual Coverage Health Reimbursement Arrangement, or ICRA type of plan. So this expanded that option, the QSARA option, essentially to both small and large employers with some differences. So one of the big differences on a small employer health plan or the qualified small employer health reimbursement arrangement, you can't have any other type of group health plan. So you can't have group dental plan, you can't have group vision plan. If you're offering this, you can't have any other group health related insurance product. On the ICHRA option, you can have a group dental plan or a group vision plan, and you can even have a group health plan that covers a certain set of employees and then use the ICHRA for a different class of employees. I mean, it doesn't have the limits, the contribution limits that the QSARA option had. And for large employers, as long as this is being, you have to have one of those plans that covers the preventive coverage with no cost sharing and no annual or lifetime limits. So you're usually pairing this with Affordable Care Act compliant coverage through healthcare.gov. So it's using that underlying health plan to meet that requirement. And so that also meets the employer's requirement to offer coverage to employees. So if you have it avoids those large employer penalties. One thing though to note is that if you do offer an ICHRA and your employees otherwise would have qualified for a premium tax credit through healthcare.gov, if you're offering that ICHRA, that doesn't, that basically means your employees will not be eligible for a premium tax credit. So they're looking at the same individual coverage, and instead of getting a premium tax credit to reduce their costs, they're just getting employer reimbursement to reduce their costs. So part of it's like the employer just taking on the cost that the government would be paying for that premium tax credit, but in exchange, then the employer doesn't have the tax penalties that would be applied to them in that situation.
There's a lot of other types of plans out there that we've heard about, you know, like the sidecar plans, some of the health sharing ministry type plans. And can you elaborate a little bit, Amanda, on how those are different than some of what you've currently talked about?
Sure, but I did want to ask Lynn to chime in real quick on her thoughts on the QSARA and ICHRA options.
Well, I would just say that I think what we've seen that be effective in the smallest employer groups where it's really a handful of employees, because the challenge that we face is insurance is such a technical product, and when we basically offer a reimbursement and then it's up to the employee to go out and figure out all the jargon and figure out what plan fits, we've actually even seen that come back and really hurt the employee. They didn't understand well enough to sign up for the right plan, and then ended up with some issues that ultimately affected the employer as well, because the employee came back with issues and problems. So I would just say that, while those arrangements, are certainly out there, employees are used to the HR, they're used to their employer, they're used to having a broker or consultant that can really help them and navigate through those options. So that's my only point on that. Go ahead and talk about Sidecar and health sharing ministries. We're seeing the ministries, that's actually come about in the last several years, and we see that more frequently, again, in the individual area, but speak to that, Amanda, as it relates to an employer.
Sure. So when we're talking about leaving the employees to go and research their options and figure that out on their own, under those other scenarios, they have to have certain qualifying coverage in order to qualify for that. Well, there are a lot of other types of plans out there that don't qualify. So one of those that's gotten a lot of advertising here recently is Sidecar Health. And you've probably seen commercials on that recently. So this is a fixed indemnity type plan. So there's no provider networks. They just reimburse a set percentage of the average cost of care in that area. And so you can go to any doctor that you want, and if the doctor that you go to charges more, you pay the difference. If the doctor you go to charges less, then you could actually pocket the difference between what their charge is and what your reimbursement is. But this type of plan does not place any out-of-pocket maximum on your cost, and they do have some limits on what they will pay. And generally, if you have pre-existing conditions, especially high-cost pre-existing conditions, they'll come out and say, oh, well, your cost under this arrangement would be higher. than what it would be on the Affordable Care Act. So we're just not going to give you a quote. So they're really wanting to take the lower cost, healthy people on these types of plans. And so if you have those pre-existing conditions, it's really not going to be a good option for you. And again, keep in mind, since there's no limit on your out-of-pocket exposure, if you have a hospital stay, some really high cost situation, there's no cap on your exposure. You could potentially have a lot of out-of-pocket medical expenses in that scenario. So it can be a decent option for some, but there's just some things that you want to keep in mind. And then as far as healthcare sharing ministries, these have been around for a long time, but we've really seen a push of these here in the last few years, more and more people joining these type of arrangements. So what's important to remember here is that these are not health insurance. They're not regulated by the state departments of health insurance, and they're not protected by the state funds that are there to help if an insurance company is insolvent and unable to pay claims. Those state funds kick in. But since this is not health insurance, those state funds aren't available for it. Now, as an individual, you may be open to looking at this type of option if you're comfortable with sharing those dollars with other like-minded individuals through that healthcare sharing ministry. But I really think that's more of an individual one-on-one type of decision. You really have to have some trust in that organization and that they know what they're doing with those dollars, because you don't have that regulation and you don't have that protection offered by the state funds. Now, when you look at offering that on an employer-sponsored basis, there's some additional things you want to consider. One, because it's not going to cover all of the pre-existing conditions, you might have some employees that it wouldn't be a good fit for. And two, it cannot meet the definition of a group health plan because it is not health insurance. And so you might be opening up yourself to some liability if your employees have an expectation that it's a group health plan, but it can't meet those requirements. And then also keep in mind that because it's not health insurance, it also doesn't get the tax favorable treatment that the IRS gives for health insurance. So if the employer contributes any cost toward that, that's not excludable from your employees' pay. They have to pay taxes on it. And if the employees are paying for it, it's not eligible for pre-tax deductions. So there's some favorable treatment of health insurance that just doesn't apply in this situation. And again, because it doesn't have the protection or the oversight from the state insurance departments, we really shy away from sponsoring this on an employer-sponsored basis. For your individual employees, it may be a good fit for them, and they may want to choose to go that route. But that should be really an individual decision that they're making, not really sponsored on an employer basis. And aside from that, there's also short-term limited duration medical plans out there. These can be helpful in certain situations. They were around, and the Affordable Care Act originally limited them to no more than 3 months in duration. The Trump administration did expand these. Currently, you can have these for up to 3 years, so they can renew up to 3 years in length. Again, you're going to see things where they don't cover people with pre-existing conditions, or if you say you have certain conditions, they won't cover you. They're going to have some limits on their annual or lifetime benefits that they'll pay. But it's a good option if you need coverage for a short period of time. Maybe you're in between employer plans or something, and you just want to have some kind of limit on your exposure for catastrophic claims. You'll typically find a lot lower cost, a lower premium cost in those type of plans, but you're not going to get a lot of first dollar coverage, just this kind of catastrophic coverage there.
Thank you, Amanda. Lynn, if an employer is currently evaluating like their existing plan, are there certain tools or benchmarks that they can use, or how would you recommend them go through that process if they're evaluating their current strategy?
Well, there's quite a few benchmarking studies out there. One that we like and recommend is Kaiser. You can Google it. We can also make it available to you, Shannon, but they do this study every year. It's probably the most comprehensive study that's out there. And it actually breaks employers into different size groups. And so for the small employer, I have the 2020 report here, and they define small employer as having less than 200 employees. If you look at the average individual deductible nationwide right now, that's $2,295 is the average deductible. In Texas, we actually really do see a little bit higher deductible on average. We see it really fall anywhere between $2,500 and $3,000. As far as the cost and how much the employee or the employer is paying, The Kaiser study shows that the average employer subsidy for self-only, employee-only coverage is about $520 a month. And then employees are paying on average for employee-only coverage about $99 a month. So total cost obviously is over $600. Now we see that vary, and we see the actual subsidy vary depending on the overall compensation strategy of a company, the industry they're in, that kind of thing. But generally speaking, again, going back to Amanda's earlier comments, while the average is about 86% nationwide, we see it between 75 to 80 just in the general area here amongst small employers. So I think the days of paying 100% of employee-only cost have been gone for a long time. For the most part, only the largest of companies are really able to do that when they can, pool their risks. But employees do, again, look at that when they're evaluating employers. We like that defined contribution strategy for the small employer, because setting a budget, knowing what the dollar amount is per employee, regardless of what plan they choose, makes it more manageable for the company. And if you're offering multiple plans, the same subsidy no matter what they choose, but they have multiple choices, employees like that as well, because they can then make a plan decision based on not only their healthcare needs, but also their own budget. So the other thing we see in Texas, very popular, more so than other states, is the high deductible health plan HSA combination. And, that's been around since 2006. And it took a while for many employers really to buy into it and adopt it, because there was concern that with the high deductible health plan, what's covered is preventive, and then everything is subject to deductible until you hit that number. But you can still see often a pretty significant cost savings between a high deductible plan and the traditional copay type plan. And if the employer and the employee will just take that cost savings that they receive, and not what they would have paid the insurance company, and instead put that in that savings account, that can be a really substantial long-term solution to healthcare costs, because that money rolls from year to year, grows tax-free. And with Medicare costs and out-of-pocket costs in retirement exceeding $250,000 for a couple, you want to have some strategy of not starting over every single year with $0 in the bucket to pay for your health care. So we highly recommend looking at those. But the key when you do implement a high deductible health plan is to make sure that you have good, solid education for the employees, so that they become healthcare consumers and think about how they spend their healthcare dollars, and really understand how the plan works so they can use it to their benefit.
Thank you. And then with everyone being virtual now, can you share a little bit about just online enrollment and tools and kind of what that process looks like? And then also timing of the year when all this happens for employers, if everyone doesn't know.
Sure. Well, yeah, you've seen lots of advertisements about the online tools that are available. And, if nothing else, through COVID, we've learned to use technology, beyond its capacity at this point. I think we're all zoomed out. But, there are a lot of options available. And, in our model, the services we offer our clients, we have integrated modules that they can choose from, that basically we create the benefit enrollment process online, so the employee can see all of their options, toggle between, different costs, so they know exactly what's going to come out of their paycheck. And then that can feed in and does feed into our payroll system, so that once an election is made, those deductions flow into payroll, and it electronically gets submitted to the carrier so that they're enrolled in the plan or terminated from the plan if they leave. And then there are onboarding, in that same module, you can do employee onboarding, so they're seeing your manual, signing off on it, doing W-4, et cetera, et cetera. And that's all well and good. It's that, they're very great tools, effective tools that can be used on a mobile phone, computer, iPad, whatever. But the element again is to be sure that there's some education, whether that's through a webinar that you put out there on your intranet or on YouTube, or even on that enrollment portal. Employees still need that color commentary portion to help them understand what all the jargon means. But yeah, I think that, and they're not terribly expensive. So I think, employers can even do some of those things on their own.
Can you share a little bit about what the future stimulus potentially coming? Do you all know, like, if it's approved, is that going to affect benefits at all?
Well, that remains to be seen. We wait for it, and it's been a roller coaster, waiting for that to happen. And we think that's really, really important thing right now. We all do. Likely, we expect in that second round of PPP that what we've seen in just the discussions that have taken place so far, likely they will include premiums for other benefits in addition to just health and dental. It looks like it's going to be for employers with less than 300 employees. But the other key that I think is really worth noting is that it appears that they're going to include some kind of requirement for qualification that you'll have to prove a revenue drop. And we don't know exactly what that's going to look like, over what period of time, what percentage, et cetera. But I think there's probably going to be, some rules around that. The other thing we've heard is the Families First Coronavirus Response Act. That was the act that required employers with less than 500 employees to provide up to 80 hours of paid sick leave for someone that was, quarantined or affected with COVID and seeking diagnosis, or to pay them up to 2/3 their full rate if they had a bona fide need to care for someone with COVID or their child's school was closed. The employer currently receives a tax credit at the end of the year to offset that cost. And so what's been discussed is that may be extended and include employers with 500 or more employees, but not giving those employers the tax credits. So ultimately, it's not done yet, so we'll have to wait and see on that.
Absolutely. And there are several states now that have enacted laws just around paid leave, and we've seen the ordinances in Austin and San Antonio and Dallas. Do you have a current update on just where that's at and how that affects small businesses?
Sure. I mean, we've heard about that for some time, and 10 states have actually passed these laws, in recent months. And Colorado may have already passed theirs. It was pending. But the challenge with that, certainly at the city level, was the idea of trying to keep up with every different city's ordinance, especially if you had employees across the state or crossing state lines. Well, that's the same issue, if different states are passing those rules. So there has been talk for some time, regardless of whether under Biden or Trump, we really foresee that there's probably going to be some federal legislation. The chambers are actually pushing for that because it's the solution to the states coming up with all these different rules and making it just unmanageable. So I would expect that in the next couple of years, probably in the next session, we'll see some of that move forward.
And I have like a couple questions just about the political environment as well, and I'll probably ask a few and then let you summarize. But what can we expect, assuming Biden wins and then Republicans probably hold the Senate and then Democrats hold the House, for example, what that would look like? And we've all heard about kind of the Medicare for all language coming out, and just, what are you foreseeing or anticipating is going to happen kind of over the next few years?
So what you're asking is, can split government really spark bipartisanship, right? That's right.
Yeah.
Well, I would say that, the optimistic outlook recalls that Biden and McConnell actually have a history as colleagues, and they actually did work fairly well together under the Obama administration to, pass some things on a bipartisan level. The necessity of working with a Republican Senate would provide Biden with a buffer against the far left wing, and divided government could lead to some possible bipartisanship. We'll see. It would be welcome. Biden sees his presidency as a return to the norms, if you will, as far as moderation. That's how he states it. With a Republican Senate, he wouldn't have much choice. Under divided government, obviously, progressive ideas sometimes become mostly irrelevant in policy making. So, there will definitely have to be a push for that. As far as the Medicare for All discussion, in Biden's, if you look at his written agenda to this point, he notes that he wants to expand government health care by establishing a Medicare-type public option to compete with private insurance, which has its own challenges and opportunities there. And he would also bring the eligibility age for Medicare down to age 60 from 65. Medicare in itself, there are a lot of issues with it, as we all know. And one of the biggest issues is that it's all 65 or older individuals in that pool. So bringing in, back to can you bring in some younger bodies into the pool and assist? So, and the reality is a lot of people are retiring earlier than 65, which was what was originally stated. So we'll probably see some movement on that. He also notes the desire to increase the value of premium tax credits for individuals in the individual market. He talks about surprise billing, which states have been trying to address. Trump also had some legislation was trying to push some legislation to address this. And we actually did have some movement on those surprise billing issues here in Texas during the last session. And I'll let Amanda talk about that in just a second because she's familiar with that. It also talks about, of course, we've heard that, his focus is on public health focus on the COVID-19 strategy and, what that would look like. But the other thing that was noted is drug pricing reforms. And that's also something that Trump had been trying to address. In fact, recent talk about pricing rulemaking for the drug pricing industry. He also was pushing to allow for Canadian import of prescription drugs to increase competition. And most recently, what has probably had the most legs is this movement towards transparency, where manufacturers, the idea was to require manufacturers to include the price of drugs in those very expensive advertisements you see every night. Those drugs on TV are wonderful things that, help people manage many different conditions. But if you're seeing it advertised, it's an expensive drug, and sometimes thousands and thousands of dollars a month. So there was a thought that, bringing that transparency would also, keep people from being surprised when at the pharmacy. So we'll see. I mean, certainly that move towards lowering the age for Medicare is probably high on the list. And the public option, Affordable Care Act has been around for 10 years. It's taken us 10 years to implement the provisions. And so any movement to a new public option is going to take a lot of time, and there'll be a lot of ground to cover, between now and that being implemented.
Thank you. Amanda, can you update just a little bit on what's going on currently in Texas? Since we have a legislative session in 2021, what are you anticipating happening? And then maybe if we could speak to that just for a couple minutes, and then we'll have a few minutes for Q&A.
Sure. So the Texas 2021 legislative session already has bills being filed. Right now, there's a couple of them that are healthcare related. Most of them are both are related to Medicaid. So there's one proposal to expand Medicaid in Texas up to federal poverty level. And then there's another proposal that would allow Medicaid recipients to access direct primary care. would have Medicaid cover a portion or all of, if it's less than the set limit of the cost to access a direct primary care physician. One of those has got Democratic support and one of them has Republican support. So we'll see what happens there. But I did want to talk a little bit more about, Lynn had mentioned that Texas had recently passed a rule regarding surprise billing. And so this is something that some people may be familiar with, but just wanted to kind of call a little attention to that. So surprise billing is when you go to see a provider that happens to be out of network, but it's a situation that would normally be covered in network. So if you're going to get emergency care, that's always covered at in-network level, or if you're going to an in-network facility and outside of your choice, they have facility-based physicians that are not in network. And so those are the types of situations where even though the insurance company pays the claim at the in-network level, since that provider doesn't have a contract with the insurance company to accept their payment as payment in full, if they charge more than that allowed amount, as they often do, you're stuck with that balance. We have called it balance bill. They use the term surprise billing here lately. Texas had actually had a mediation process for these types of balance bills for a while, but in 2019, Texas Senate Bill 1264 was passed that required the insurance company and the providers to handle that negotiation directly with each other instead of having to have the member foot the bill or initiate that mediation process. That bill actually went into effect at the beginning of 2020. So that's on plans in Texas right now, or plans that are subject to regulation in the state of Texas. So that's going to be your fully insured plans that are based in Texas. So the challenge though is you still have people in Texas that are covered by other types of plans, self-insured plans that are really regulated at the federal level, or states that are or plans that are based in other states. So many large employers that have employees across many states, they'll have their plan based in one state, but all of their employees are covered under that plan. So if you're not on a fully insured plan in the state of Texas, that surprise billing law that went into effect this year doesn't really impact you. That's why we've been hearing a lot of things at the federal level about surprise billing. And really, we had kind of anticipated that they would have passed something this year. Unfortunately, it was just delayed due to COVID. So as Lynn was mentioning, under both Biden and Trump, they had both had surprise billing as something they wanted to address as part of their healthcare agenda. So we're really hoping that we see more movement on this in 2021.
Thank you. There's a couple questions that were posted in the chat. And so one question was the penalties for employers. Are there exceptions or exemptions for nonprofits? And I don't know if y'all happen to know that off the top of your head, but for a nonprofit organization, do the same penalties still apply for health insurance?
Yes, so if you have the 50 or more full-time equivalent employees in the prior calendar year, you are an applicable large employer, whether you are a nonprofit or a for-profit, and the same penalties will apply. Okay.
And then if an employer right now has a strategy where they essentially are using a cost share ministry as part of their strategy for their employees, and let's say they're paying a flat percentage or a flat dollar amount per month, my understanding is you can't really call that a health insurance reimbursement because it's not a qualified plan. So can you expand on basically if your employees are using a non-qualified plan and you're wanting to contribute, what's the best way to do that? Do you just increase comp to offset it, or can you actually call that a health insurance reimbursement?
Lynn, I don't know if you want to take that one or you want me to cover that.
Either way, go ahead.
Well, since it's not health insurance and it doesn't qualify under the IRS tax favor guidelines, and if you're wanting to just gross up your employees' pay and say, here, I'm just going to give you some extra pay and you can use that how you want. If you're saying I'm reimbursing you for a specific plan, then you get into, well, now if I'm reimbursing you for that plan, it kind of can fall under the employer health plan rules. And again, it's not health insurance, so it can't meet those requirements. So I would shy away from reimbursing or sponsoring in any way that type of thing on an employer sponsored basis. If you just want to give your employees extra pay and they can use that for whatever type of health coverage or health care they want, that's their choice, as long as you're not endorsing it in some way.
Are you still allowed to, as an employer, to have an option? For example, if someone's participating in your plan, they kind of check one box, but if they're not participating in the employer plan, then they get, you know, $300 a month or something like that. Are employers still allowed to do that and essentially offset or basically increase their employees' pay if they're not participating in the employer-sponsored plan?
Sure, you could do, I mean, your compensation strategy can vary by employee. So, you know, the only danger with that is we have seen in some cases where a person's pay was increased because they weren't participating in the plan, and then their spouse lost coverage. And then, you know, here you are with somebody who's there's pay disparity between a similar position. So you want to be very careful from an HR perspective if you have two similar positions and you do that, and then suddenly the deal changes. So it has some, you know, it has some traps in it, I would say.
Yeah.
But yeah, we
Definitely. But you couldn't have it be triggered specifically based on basically if you are participating, or if you're not participating, we pay you the $250 that we normally would have matched because you're not participating. You can't have it necessarily be a specific trigger around if they are or not participating. Can you? And that might be more of an HR question, but I know, and it's probably a hard question. I remember years ago, I felt like employers used to be able to basically pay you if you weren't participating.
Yeah, technically you probably could, but then you also have then, you know, the issue of, again, you know, the disparity issue, proving that out. So I would navigate that pretty carefully. I almost want, the reason I'm hesitant is because it's really, that's a case by case. That's not something I would say would be a broad employer strategy. You want to look at the demographics of that group to really see if that would make sense and if it would work long term.
That makes
That's
sense.
something where you could look at the flex credit strategy. So you're giving all employees a set dollar amount that they could use. They could use it toward medical, and if they don't participate in medical, they might be able to use it towards some other benefits, dental or vision, and FSA contributions even to some extent. So there's some other ways you can help give them some money in the benefits pool, even if they're not on health insurance and not directly in compensation.
That's a great idea. And so that's called you said the flex pay?
Flex credit.
Flex credit. Thank you. No, that's a great point. And I agree, Amanda, usually if somebody's talking about a health care reimbursement for employees for them going to get their own insurance, I usually advise our clients not to structure it that way, because you're better off just adjusting compensation. Because if your employee goes out and they are getting insurance on the market, you could get hit with some penalties there and not know it's coming. And so the environment's not the same it was several years ago, where you could, you know, reimburse employees for things as it relates to healthcare. Because basically, if they go out to the market and they get a discounted plan, then the fact that you've reimbursed them for part of that plan, you basically get hit with some fines and penalties for that. So it's just something to be aware of. So I would highly recommend talking through that with an HR company like a BFG or with BFG, because there's a lot of other potholes and things now than they were, you know, maybe 10 years ago. So with that being said, I don't see any other questions down at the bottom. And then Lynn or Amanda, is there anything else you wanted to share before we wrap up?
I wouldn't have anything other than to, you know, stay tuned. It's going to be an interesting land the next few years.
Yeah, absolutely. And one thing I do want to mention is if you're interested in not to just volunteer at Lynn, but Lynn has a wonderful, they send out some great newsletters with lots of really helpful information. And so if it's something where you would like to be introduced to them or potentially be on their newsletters, go ahead and please reach out to me so I can make that introduction, because they send out really great updates on HR benefits and just various public policies that I think are really helpful.
Thank you, Shannon.
Yeah, absolutely. Well, I appreciate you all taking your time just to be here today. And thank you everyone that joined us today. We appreciate having you, and hopefully you found it helpful. If you have specific questions that we didn't hit on today, or maybe you need some clarifying, clarification around a few, please just shoot me an email, and I will follow back up with you next week. So have a great weekend, everyone. Appreciate it.
Thank you.
Bye.